Hello, we are Group 8 and we'll be discussing about neoplasia. So neoplasia is the formation of new cells on the tissues of the body. The uncontrolled growth of neoplastic cells deviates from the normal functions and orderly arrangement of a normal cell, hence becoming transformed. So neoplasms are autonomous and do not respond to the normal growth controls of the body. So these proliferating tumors may appear as swellings on the body surface, which could be harmless or harmful to the host. So we have an image here which shows an example of fibrosarcoma, which also blocks the oral cavity of the dog. So there are two types of neoplasms, which are the benign and malignant. So their similarities. Both types of neoplasms are composed of the parenchyma, which are the neoplastic and transformed cells itself, and the stroma, which are the tissues that support their growth by providing blood supply. So in terms of differences, in a benign neoplasm, it remains localized, non-invasive, can be excised, and does not cause death. On the other hand, a malignant neoplasm is invasive and destroys adjacent structures, can metastasize, and cause death. We also have here, in terms of differentiation, they are well differentiated in benign neoplasms and some lack of differentiation in malignant neoplasms. In terms of rate of growth, they are slow in benign neoplasms, so they are usually progressive, while it is faster in malignant neoplasms, which are may start slow then become rapid. In terms of local invasion, like what I've just said, it is non-invasive in benign and it is invasive in malignant. It is in terms of metastasis, it is absent in benign and it is frequent in malignant. In some cases, a benign neoplasm can cause death if its location interferes with an important body function. So the malignancy of tumors may also vary. Some may not cause death if it is well differentiated or share some similarity with that of a normal cell. So let's move on to the nomenclature. We use three suffixes, which are the oma, sarcoma, and carcinoma. So neoplasms are named depending on the type of neoplasm. So in benign neoplasms, the suffix oma is added to the cell type from which the tumor arises. So benign neoplasms include fibroma and chondroma, which are a benign tumor of fibrous tissue and cartilage, respectively. In malignant neoplasms, the terms carcinoma and sarcoma are added with the cell type from which the tumor arises. So malignant tumors of mesenchymal origin use the term sarcoma, while those of epithelial origin use carcinoma. So for example, the malignant form of fibroma is fibrosarcoma, which is a malignant tumor of fibrous connective tissue cells, and the malignant form of chondroma is chondrosarcoma, which is a malignant tumor of chondrocytes. So they just added sarcoma. And for the case of carcinoma, they just added, for example, the uh, basal cell carcinoma. We also have uh, we also have another type called mixed tumor that exhibit more than one tissue type. They are named depending on the list of types of neoplastic tissues present. The list can also be written in compound words. Like for example, a mixed mammary gland tumor composed of fibrous connective tissue, cartilage, and bone. When compounded, uh, it is called fibrochondrosarcoma, osteofibrochondrosarcoma. So the list malignant tissue is placed last. Yeah. So let's move on to the classification of tumor. So there are four types, which are the epithelial, non-epithelial, dermal cyst tumor, and teratoma. Epithelial tumors include papilloma, adenoma, and carcinoma, which originate from epithelial surfaces, either squamous or glandular. We also have non-epithelial tumors, which include fibroma, chondroma, and osteosarcoma. which originate uh, from uh, from connective tissue, such as fibrous tissue, cartilage, and bone. We also have uh, we also have the dermal cyst tumor, which originate from embryonic defect and growth, and it is composed of one germ layer only. We also have teratoma, which is also the same with with the dermal cyst tumor, but the difference is it is composed of two or more germ layers. We also have mixed neoplasms, which are common. They are usually clinically benign, but may undergo malignant transformation. They are the divergent uh, they are the divergent differentiation of a single neoplastic clone, such as mixed tumor of salivary gland, which contain epithelial components scattered within a myxoid stroma that may contain islands of cartilage or bone. References, and that's it.
Macroscopic appearance of neoplasm. Um, Neoplasms are characterized by their lack of defined size, shape, color, or consistency. The macroscopic appearance of the tumor is influenced by a number of characteristics, um, including its location, kind, blood supply, rate of growth, and length of time it has been there. Next. Next. Um, in neoplasms, it has color and consistency. Um, in color, lipochrome pigmented fat, if present, gives the tumor a yellow color. If the tumor is black, it has the presence of melanin. If it turns pink or scarlet, it is due to hemorrhage or hyperemia. Um, the consistency also changes depending on the tissue type, and the consistency is described as sclerotic or fibroic. Because they mimic brain tissue, some tumors are excretingly soft and friable and are referred to as encephaloid. And lastly, if degeneration, suppuration, and neosis are present, tumors may be mushy and liquid. Edema causes some tumors to have fluid consistency. Next.
Microscopic appearance of neoplasm. So when we say microscopic, it means so small to be invisible or indistinct without the use of microscope. So in short, it can only be seen using a microscope. And here's an example of microscopic appearance in neoplasm. For example, in benign. Yan. The case here is lymphoma. Yan yung makikita natin sa loob ng ating microscope. And of course, para ma-determine or differentiate between benign or malignant tumor, when we say benign, cells are not cancerous and won't spread, while malignant is the opposite. Cells are cancerous and can spread to other tissues and organs. And anaplasia. When we say anaplasia, it is the hallmark of cancer, lack of cellular differentiation. So when we say lack of differentiation, it's like the case here in the fourth bullet. The cell is not similar to its original cell, then it is called anaplastic. And when we say anaplastic, it is a cancer cell that divide rapidly and have no little resemble to normal cell. It is abnormal compared to the normal cell. And of course, anaplasia is characterized by hyperchromasia, enlargement of nucleolus, increase in mitotic figure, and giant cells. So what we have here first is hyperchromasia. When we say hyperchromasia, it is the dark staining of the nuclear chromatin. As we can see from the picture here, we have the normal cell and hyperchromasia. We can easily observe the dark staining of the nucleus in the normal cell. And next is the enlargement of nucleus. So when we say enlargement of nucleus, of course it is extremely large and may become 2 or 3 times larger than their normal size. And we also have an example of the enlargement of nucleus here, from the normal cell to the cancer. And third is increase in mitotic figure, a cell that is in the process of dividing to create a new cell. And lastly, giant cells, larger than the neighboring cells, possess either or very big nucleus or several nuclei. So to make it short, anaplasia is um, it is the hallmark of cancer, and the cells in anaplasia is different in the normal cells. And of course, it is subnormal. That's it.
Let's talk about the characteristics of benign and malignant neoplasms. Benign neoplasms develop slowly, are normally encapsulated, are often pedunculated if found on the surface, do not metastasis, and do not recur after being removed. They are not harmful unless they grow near important organs, push on a nerve, or block blood flow. They can grow to be quite enormous, weighing up to pounds. If they develop in the brain, the usual structure is in the enclosed space of the skull. They can be harmful. In this example, a schwannoma was removed from a nerve. Despite its benign nature, this tumor has the potential to produce nerve damage due to mass effect. On the other hand, malignant neoplasms are dangerous because they spread locally, develop quickly, are not encapsulated, metastasize to other areas of the body, and recur after excision or irradiation. Also, cancer is a term used to describe malignant neoplasms. Cancer is derived from Latin and means crab because malignancies cling to any area of the body they grasp with a persistent grip, much like a crab. This is an example of malignant neoplasm that invades adjacent tissues. A lung cancer's dark tissue observed migrating along the airways into the surrounding lung is seen in this image. The lymph nodes in the dark circular regions are also affected by the tumor. Let's proceed to the differences of benign and malignant neoplasms, which are divided into 4 categories: differentiation and anaplasia, growth rate, local invasion, and metastasis. First, the differentiation and anaplasia. Differentiation and anaplasia are exclusively observed in parenchymal cells, which form the altered elements of neoplasms. The degree to which parenchymal tumor cells physically and functionally resemble their normal forebears is referred to as differentiation. Benign neoplasms are made up of well differentiated cells that look very similar to their healthy counterparts. When it comes to neoplastic cell functional differentiation, the better the differentiation, the more the cell preserves its normal functions. This is an example of benign lipoma on the serosal surface of the small intestine. It mimics the tissue of origin and has the features of a benign neoplasm. It is well confined, slow growing, non invasive, and closely resembles the tissue of origin, which is fat. Another example, as seen in this cutirus, it has multiple benign neoplasms with leiomyomas of various sizes. But they are all benign and well circumscribed firm white masses. This is an example of hepatic adenoma, a rare benign neoplasm but one that demonstrates how well defined a benign tumor can be. Adenomas typically grow very slowly and look like a small mushroom with a stalk. Anaplasia is a situation in which cells lose their morphological properties of mature cells as well as their orientation in relation to each other and endothelial cells. Malignant neoplasms made up of undifferentiated cells that are said to be anaplastic cells. The nuclei are very hyperchromatic or dark staining and big in anaplastic cells with considerable pleomorphism variation in size and shape. Malignant neoplasms, extremely anaplastic undifferentiated cells, differ significantly from normal cells from which they develop. They may even generate fetal proteins that normal cells do not produce. As a result, the less probable a tumor is to have specific functional activity, the faster it grows and more anaplastic it becomes. This is an example of malignant neoplasm of the lung arising from the epithelial of the bronchus or bronchiole as what you can see. It looks very different from what is normal. Another example of malignant neoplasm is a neoplasm mass in the lower pole of this kidney that distorted and displaced the normal renal parenchyma. This is renal cell carcinoma. The sliced surface of this malignant neoplasm is diversified, with yellow to white to red to brown patches. Next category is the rate of growth. Most benign neoplasms develop slowly and have distinct borders, but most malignancies grow quickly, eventually spreading locally into distant areas and resulting into death. This generalization, however, has many exceptions and some benign neoplasms develop faster than malignancies. The rate of growth of malignant tumors is usually inversely proportional to their differentiation level. Neoplasms that are poorly differentiated grow more quickly than neoplasms that are highly differentiated. The rate of growth, on the other hand, varies greatly. Some transformed cells grow slowly for years before exploding, indicating the presence of aggressive subclone of transformed cells. Others develop more slowly and steadily because the tumor blood supply, which is taken from the host, cannot keep up with the oxygen needs of the swelling mass of cells. Rapidly growing malignant tumors frequently have central zones of ischemic necrosis. This is benign nevus, or pigmented mole, of the skin. It is the most common neoplasm, and most people have several, but it grows slowly, as seen here on the chest area. While, on the other hand, this is malignant melanoma. It is bigger and more irregular than a benign nevus, as shown in this skin excision. It grows quickly and is life-threatening if left untreated. This is liposarcoma. The retroperitoneum and thigh are common sites and they affect people in their middle to late 20s. This one is yellowish and well differentiated, like fat tissue. Despite its indolence, it continues to develop until it reaches a significant size and has a proclivity to recur after excision. The third category is local invasion. A benign tumor remains confined to its origin location. A benign tumor remains confined to its original location. It is incapable of infiltrating, invading, or spreading to other locations. The majority of benign tumors form an enveloping fibrous capsule that separates them from the host tissue as they grow. Following atrophy of the parenchymal cells due to the pressure of the developing tumor, this capsule is made from the stroma of the native tissue. Not all benign tumors, however, are encapsulated, thus indicates that tumor is benign. The absence of capsule does not indicate that a tumor is malignant. Malignant neoplasms spread through the surrounding tissue by infiltrating, invading, destroying, and penetrating. They don't produce capsules. A slowly enveloping malignant tumor may appear to be encased by surrounding tissue's stroma. Yet, microscopic examination reveals small crab-like feet piercing the margin and invading the surrounding structures. This invasion takes place along anatomical cleavage planes or the path of least resistance. This is osteosarcoma, huge, thick mass benign in the bone's cortex spreads outward. Another example, this is a type of lung cancer called squamous cell carcinoma. It is a large mass that invades the parenchyma of the lungs. This cancer affects the large bronchi, causing cough and hemoptysis as symptoms. Unfortunately, such signs and symptoms usually appear after the cancer has grown to a great size, making treatment more challenging. An excisional biopsy revealed invasive ductal neoplasm in the first picture. A big irregular pink tan mass with slightly depressed surface has been discovered. Necrotic lesions, foci are yellow-white patches. Tumors that have a stellate appearance have a worse prognosis than those that have limited outlines. Mm. Below is a breast carcinoma with previous biopsy site, a large tan-white invasive tumor with a brown nodule matching the prior needle core biopsy site is shown in this image. The invasive tumor has spread to the surgical resection margins. Last category is the metastasis. The term metastasis refers to the formation of secondary growth. These develop in distant tissues and are not connected to the main tumor. Metastasis is the spread of cancerous cells from one place of the body to another via blood arteries or lymphatics. The word metastasize is a noun, and the adjective is metastatic. More than any other characteristic, metastasis is the second distinguishing hallmark of malignant tumors. Not all malignancies, however, have all the same ability to spread. Stage 4 breast cancer is also called metastatic breast cancer or advanced breast cancer. Cancer that developed in your breast has spread to other areas of your body. Cancer cells might have traveled through your lymphatic system to your lungs, bone, liver, brain, or other organs. Well, this is the view of colonoscopy of adenocarcinoma of the colon. This is bulky mass which spreads over the colonic mucosal surface. It has surface areas that appear red because of the bleeding, and this led to a positive occult blood stool, which was the screening method for detection. Neoplasm may not maintain the structure of normal tissues, so there is often irregular growth with necrosis and hemorrhage, particularly in larger and more aggressive neoplasms.
Neoplasia pathway of spread. First is hematogenous spread. This is the favored pathway for sarcomas, but is also used for carcinomas. Arteries are more resistant to invasion, unlike veins and lymphatics, due to the thickness of the arterial walls, but also due to elastin content of the arterial walls and their secretion of protease inhibitors. Hemorrhagic spread, the lungs get all cable blood, and the liver receives all portal area drainage. The lungs and liver are the most commonly involved secondary sites in such hematogenous spread. Lymphatic spread. This lymphatic spread is like the hematogenous route for sarcomas. Lymphatic spread preferred pathway for carcinomas. Lymphatic spread invariably involves the regional lymph nodes. Lymphatic spread can spread through either lymphatic and vascular systems due to numerous interconnections to both systems. All forms of cancer may spread through the both systems. These spreads generate response alterations in lymph nodes, such as enlargement of hyperplasia of follicles and proliferations of macrophages in the subscapular sinuses. Seeding within body cavities is the transfer of tumor cells from one serous or mucous surface to another by direct contact. Seeding of malignant tumor occurs when they invade a body cavity. This method of spread is particularly characteristic of cancer of ovary, which often cover the peritoneal surface widely. Another example of seeding is the venereal granuloma in the dog, where tumor cells are spread by coitus. Spread of malignant neoplasms. The spread of malignant neoplasms through lymph channels to lymph nodes is what we call the lymphatic spread. The spread via bloodstream is what we call hematogenous spread. And seeding is the spread of neoplasms within body cavities. This is an example of seeding within body cavities. As you can see that it is an example of breast carcinoma that spreads within the lung. Malignant neoplasm spreads on bronchi and surrounding lung, and migrate via blood or lymph system and establish new tumors in distant parts of the body during metastasis. It is termed metastasis when cancer spread. Cancer cells break away from their original sites of formation, migrate via blood and lymph system, and establish new tumors in distant parts of the body during metastasis. Cancer has the ability to spread and particular any part of the body, however, it is frequently invades bones, livers, and lungs. As you can see in the right side of the slide, this is a tan tissue of a lung cancer that seen to be spreading along the bronchi into the surrounding lung. Another carcinoma that invades into surrounding lung parenchyma. The image that you can see is an example of spread of the squamous cell carcinoma of the lung. Next is the nest of malignant cells. It is termed perineural invasion because it invades the branch of peripheral nerve. Spread of benign lipoma. Take note that benign lipoma tend to grow slowly and do not spread. Benign lipoma has the characteristics of slow growing, well circumscribed, and non-invasive, and commonly seen on the serosal surface of the small intestine.